modern medicine has gone so far away from quality healthcare. Yet they pat themselves on the back all the time because they're hitting their numbers, they're hitting their metrics, but they have completely lost the plot. We went off the rails in medicine when we accepted third-party payment. And what did they actually mean by quality? Well, it had nothing to do with actual quality. It had to do with hitting certain numerical benchmarks. That's not what quality is. The central aspect of a quality medical relationship is caring, actually caring for another person and communicating the caring to that person. It's a form of love.
Hi there, Richard. Thanks for coming on. This is the Quality Values Podcast. I'm excited for this episode. I named this podcast Quality Values in part because of Robert Pirsig's book, Zen and the Art of Motorcycle Maintenance. It's kind of a discourse on the idea of quality. I was digging around on Substack, and I found one of your articles. It was Zen and the Art of Health Maintenance. So that's how you came onto my radar. Interesting article, interesting Substack overall. So thanks for coming on, Richard.
My pleasure.
Let's just jump right into that article, just because that's where I found you. This podcast it's kind of a broad podcast. The question is, what are your values in the context of your story? Just to build out the context, you're a doctor. What's been your experience in the field, and then what were you kind of getting at with that article, Zen and the Art of Motorcycle Maintenance?
Well, I graduated medical school in 1981, so I've been around for a while. And I saw, when I started practicing, I felt that medicine was high quality in the United States in general. And then I saw it start to be measured, right? And made into a thing. There were all these quality assurance programs that came into being. And it occurred to me that because I had read that book, I had read the Zen and the Art of Motorcycle Maintenance, that they had no idea what quality is about, right? So how are they going to go about measuring it? And that's what led to my writing that essay, because that was the era of health maintenance organizations. And those were the ones who were pushing this whole initiative to assess quality. And what did they actually mean by quality? Well, it had nothing to do with actual quality. It had to do with hitting certain numerical benchmarks for various outcomes. That's how they defined quality. And so I had to push back against that. That's not what quality is. And I'll refer you to Robert Pirsig for an actual definition of quality. And what I came to in that essay was that just as Pirsig comes to the conclusion that quality isn't really a thing, it's an event. It's an event during which the subject becomes aware of the object. It's an interaction, in other words. And the interaction in medicine is the patient-physician relationship. So my thesis was that quality in medicine hinges entirely on the quality of the patient-physician relationship, and that anything that interferes with that reduces quality. So that these very measurement systems that were put into place back in the 90s, really, and thereafter, to assess quality were actually destroying quality in medicine.
Interesting. It's like, once you define quality and set these parameters around it, you kind of lose the whole Robert Pirsig quality is you can't give a concrete definition for it, and he kind of chases it. But while you can't give a concrete definition, that there's a kind of universal nature to it where, if this I would consider a high quality shirt, and I'm sure that if you were here and you could see the threads, you would agree. We have this shared sense of what quality is, even though it's hard to define it universally.
Right.
I guess, can you take me through in your practice and your experience, and what does that quality doctor-patient relationship look like? You're kind of getting at what it's not with when you're defining the quality, but what does it look like when it is firing, when it does have that feel, you know?
I would say the central aspect of a quality medical relationship is caring, actually caring for another person and communicating the caring to that person. It's a form of love. Okay, caring is a form of love. And if you embrace your patient, not physically, but if you love them as a patient, as a person, who they are, you appreciate who they are for their humanity, for their uniqueness, and you're going to use your skills and knowledge to try to help them. That is the essence of a quality medical relationship. And the patient understands that and feels it. And that is what leads to healing, in my view. It's not anything that you actually do. And when you have this quality interaction, you are rewarded by the patient telling you that they feel better as they're leaving your office. They feel better already because of the fact that you have cared for them, taken your time, given them your energy and your expertise. That is already starting the healing process. I haven't done a thing, right? I haven't done an operation. I haven't done a prescription. No, it's just the fact that I'm sitting down with them, sharing their life for that moment without distractions. And that's another part of what makes a quality relationship. You have to have a comfortable setting. It has to be quiet. There can't be intrusions. You can't have a computer telling you what to do, which is what a modern medical interaction is all about. Modern medicine has gone so far away from quality healthcare, yet they pat themselves on the back all the time. I mean, these people in administration, particularly, because they're hitting their numbers, they're hitting their metrics, but they have completely lost the plot.
Yeah. So let's get into this a little bit more, since several of your essays, your articles are kind of getting at the American medical system. And so what would you say are like is the foundation of the dysfunction that you talk about in different ways? Like, we're talking about the quality metrics and the focus on that, but there's money comes into it, and we're missing the plot, as you're saying. So, like, what plot are we writing out here? Like, what does it look like? And
Yeah, well, we went off the rails in medicine when we accepted third-party payment. That was the beginning of the end. When we agreed to accept an insurance payment directly from the third party, we became de facto employees of that third party. And then we therefore had to toe their line. We had to report to them diagnostic information, personal information about the patient. That is actually a breach of medical confidentiality, but it became routine. Doctors didn't even think twice about breaking that confidentiality. And that has disrupted quality of the relationship in a big way, right? Patients are not really secure that their information is private. And it's only gotten worse with the electronic health record. All of these are attached to the internet in some way, and they are all hackable. And there have been many data breaches involving personal health records. And even if there isn't a breach, there are always other people looking at that record, right, that you don't know, especially when you're dealing with a third-party payer, right? They sometimes request the charts. I have a friend who went through pre-med with, we're lifelong friends. He went into psychiatry. Well, the third-party payment in psychiatry these insurers demanded to actually see copies of the charts, and he refused. And then he went totally private and just accepted cash from that point on. So his records are confidential. So that's a big part of it. Doctors, if they want to get back to having this quality relationship with their patient, need to reject third-party payment. They need to completely reject what has become standard, which is the corporate practice of medicine. They become part of a corporation, a hospital group or something like that, or some large group, and they therefore have to follow the rules set by this group. And these rules now tell about how you treat patients. They're limited in terms of time. They are forced to see a large volume of patients in a short period of time. Well, how can you possibly have a quality interaction in 7 minutes? I think it's impossible, if not extremely hard. You have to be able to take the time to get to know a patient, figure out what's wrong with them. I would say a minimum of 30 minutes, 45 minutes for an encounter with a new patient. Now, with a follow-up, yes, you can do a follow-up in 10 or 15 minutes. But even that is more than doctors are expected to give to patients these days. It's more like 6 or 7 minutes now. And a lot of that time, the doctor, of course, is clicking on his computer, entering data points so that these bean counters can assess their quality, right? That's really what it's all about. And bill. They have to put in a lot of information, much of which is now on a boilerplate that documents a fictitious, comprehensive history and exam that you didn't do, but which you're going to submit if they ask for it to justify billing at a certain level, right? The billing codes were also a huge point of where the medical profession took a huge downturn. This happened in the early 90s. The resource-based relative values scale was a Marxist concoction of a Marxist communist, literally, professor at Harvard, William Hashaw, who came up with a formula, complex formula, to assess physicians' work and to monetize it. So they would get each visit or procedure would have a certain numerical score, and that would be multiplied by a number, arbitrary, to come up with a dollar amount for that encounter. Well, once doctors got forced into this, the game was over, right? Because they could no longer control their own billing. And if you can't control your hours, your billable hours, like lawyers do and like dentists do and every other professional does, you're not going to survive. Your business is going to fold. If you are allowing your fees to be dictated by the third party, well, they don't know what your expenses are. They don't know how smart you are. They don't know how accomplished you are. They don't really care, right? They're going to dictate and tell you what you're worth no matter what. And once doctors agreed to that, that began a downward spiral in private medical care. And the only way that doctors could stay in private medical care was by getting out of that system entirely and starting a self-pay, direct pay practice. Now, fortunately, a significant number of doctors went that route because they loved the art of medicine. They wanted to continue to practice, and they saw that they would not be able to under such a constrained and artificial system. So they said, the hell with it, I'm getting out. I'm hanging up my shingle. It took a little bit of gumption to do that, right? You're going to take a financial risk, but ultimately, most of these doctors that I know did well. They did well.
There's this book I like called Skin in the Game, Nassim Taleb. And this idea of skin in the game has kind of become a fixation of mine, where I feel like in order for to grow in an area, you have to have skin in the game to respond to the results, positive or negative, of whatever you're doing, right? So I think in this context, the skin in the game and the interaction, the doctor-patient interaction, would be time on the doctor's side and money on the patient side. And the system as you're describing is kind of minimizing the skin in the game on both sides of that equation, where the doctors are shrinking their time and the patients are, they're just paying their deductible, but like that interaction that day, they don't necessarily have skin in the game for it. They're paying their monthly, their annual, or whatever. But there's they're missing that element of presence, because it's balanced over time. But it was.
I believe that is a big part of it. That is a big part of it.
Yeah.
And patients are missing out by agreeing to third-party payment as well. And patients have to become aware of this, and they have to understand that if they want to have a good quality relationship with a high-quality physician, they have to pay for it themselves. Now, they may be able to get reimbursement from a third party. That's a different story, okay? That's okay as far as I'm concerned. But the actual interaction should be private between the patient and the physician and totally confidential.
Interesting. The confidentiality aspect is something I haven't thought of as much as you're emphasizing it, but I do see the importance of it. It's, it's interesting. That's a kind of a new thought for me. I wear many hats. One of them is a personal trainer, and I like being a personal trainer because it's an out-of-pocket thing. The people who I train, they want the training. They see the value of it. They're trading their money for it. It's hard to make a good living doing it though, because all the money in that field, it's a lot easier to make money as a physical therapist, chiropractor, massage therapist, even like some specific modality with a degree, and with that degree comes the ability to get the third-party payment. I did one episode with a doctor for fighters. His name is Dr. Kickass, or that's what he goes by on the internet, but he trains UFC fighters and other MMA fighters, and he deals with this because he's a physical therapist, so he can help with their injuries up to once they can put their shoes on, put their shirt on, they can get through their accidentally living. Insurance doesn't cover it anymore. And so then he becomes a performance specialist at that point, and the payment structure changes. And I was just like, that's crazy. That's a crazy system that he's dealing with, since he has to charge the same patients differently at a certain point. I wondered, are there systems in the world that function differently, that do a better job of enabling the doctor to care, the patient to have more skin in the game?
There are private doctors all around the world still.
Yeah,
we have to seek them out. I mean, the Brits with their National Health Service created this huge scam, huge entitlement, locked the country into socialism forever. But cleverly, they allowed physicians to maintain a private consultation. So you'll see in the NHS, these consultants, which are at the top level position in the NHS, seeing their share of NHS patients and having maybe even a panel of patients, but they still have their private office where patients can go and pay cash. And that's how they jump ahead in line, right? Everyone's heard about the long waiting lines that socialized systems produce, because there's no real incentive to see a patient, because you're getting sort of a fixed amount. In the UK, I believe that they're getting an amount per patient on their list, right? They get a list of patients. So they get paid that no matter what. So that actually gives them a disincentive to see anybody, because they start to lose money as soon as they start to actually spend time with a patient. So that's a perverse incentive. You want a physician to be financially incentivized to see you and to take care of you. And that only happens in a true fee-for-service system. Fee-for-service has been demonized because, of course, they want to control payment to physicians. This whole plot, I believe, to get rid of private medicine has been highly successful. When I was training, 90 or 95% of people leaving training, doctors going out of training into the real world, would go into a private practice. either set up shop on their own or join with a partner or two. Now it's probably like 20% or less. So there's been a huge loss of private physicians to the detriment of our health, because that was where you got the best care. There's just no question about it. Without that, you end up in a clinic situation where you're not even seeing the same person every time, right? You might see someone else, or you're going to be seen now by a nurse practitioner, or a physician assistant. Not to denigrate these wonderful people, but they don't have the same level of training or expertise that a physician has. So you're not in an optimal situation to, get answers to your medical problems, shall we say. And the only way out is to agree to pay for care directly. Then you will find doctors who will take care of you. Of course, your insurance policy is another scam. You're paying a lot of money, and they don't really provide you with good care, or they don't pay for good care. They try to avoid paying for expensive items. They require pre-authorization. They reject many claims straight off the bat, right? Forcing the doctor to jump over hurdles to get paid. And they don't pay very much, right? The third parties, Medicaid was always a joke. Medicare started out as a generous reimbursement program for physicians, and actually in its initial version was actually acceptable, and doctors bought into it. Like, doctors accepted Medicare and they participated in large numbers. This is back in the 60s when they first started the program. They allowed doctors, first of all, they were paid by their patient. Then the patients could bill, or the doctor could bill for them, right? But they were still getting paid by the patient, and they were only getting reimbursed 80% of their bill. So the patient, in any event, had to come up with at least 20%. So there's your skin in the game there. But the doctor was able to bill his usual, customary, and reasonable charge. So doctors did that. They billed their usual, customary, and reasonable charge. And all of a sudden, there's all this money going out of Medicare. Well, what do they expect? They have an insurance program like that, and people are going to use it. Of course, people are going to bill Medicare. But then after that, they started to say, hey, we can't let this go on like this. There have to be controls. And they started to add different layers of controls. And also reduce the payment. They eventually adopted a process where the payments were automatically revised downward if the total Medicare spending in a given year exceeded a certain threshold. Well, there's a phenomenon that I've actually written about years ago, where if a doctor is seeing a higher volume of, the doctor is getting less, let's say for an office visit, they will immediately, without even thinking about it, schedule more office visits. And that leads to more stuff being done to patients. So when you start to cut physicians' pay, the volume of services immediately goes up, like overnight. And with that, total costs go up, because the doctor's share of the expense pie is only about 10%. Okay, most of the money is going to administration, nursing, hospitals, drugs, right? Everything but the actual physician providing the care. So it's a system that is going to spiral downwards, and it has. It has. Reimbursement rates for Medicare patients have gone down to levels where many doctors simply can't participate, cost them too much, and they're not getting fairly compensated.
I'm curious, how have you built your practice, both from a business perspective, and then also from a medical approach perspective?
So I left my practice in 2016 in the wake of a hospital takeover by a large hospital corporation. They ended up destroying our wonderful community hospital in New York. But I took a teaching position down in Grenada at St. George's University, teaching clinical diagnosis. And I stayed down there until 2021. During COVID, they closed the island. They closed the school. They just had everything online. So I taught online for a while. But also during the initial wave of COVID, went up to New York City and volunteered as a nephrologist at Bellevue Hospital, where they had a lot of kidney issues, a lot of kidney failure. When I got back down to Grenada later that year in the winter, really, they were talking about having a vaccine mandate for all the medical school personnel and students. This was a couple of months after the rollout of these shots, which were brand new, clearly experimental. They had no long-term safety data whatsoever, and they had only a couple of months of short-term safety data, and I refused to take one. So they terminated me. So I have not gone back into a formal practice setting, although about a year ago, I joined a group called Gold Care Health and Wellness, which was set up by Simone Gold, who's a physician and a lawyer, to try to remedy a lot of what is bad with medicine, as we've been discussing. So patients who want to participate join this association and agree to be governed by the rules of the organization, by the association. So that enables us to escape some of the constraints of the state-run system. And I've been working there as a consultant, sort of a glorified health coach, but I'm able to help people get off of medication, for example, restore their health through proper eating. That's really what I focus on these days.
Yeah.
And I actually also do some nephrology consulting in that way. But again, it's all within this framework. I am paid directly. It's a very modest fee, really, when you think about it. We don't do insurance at all. There's no third party. There's no outside auditing. It's all confidential stuff. So this is a good system that I, have been happy with.
That's pretty cool. That's interesting. I want to get back to the vaccines too, since I saw some of your posts about that, and I'm interested on your thoughts on that. But this health coaching thing, it sounds like you're in a position now where you can really say what you think. You're not you kind of have custom expectations, and like the people who are coming to you for what you want to give them rather than what so that's the context that you've got. What was the organization? Gold
Care.
Gold Care. It's pretty cool. I'll look it up. So if you're coaching someone purely just to help them out, you just mentioned diet. I'm curious what are you mentioned getting them off of medication, which I thought was interesting. And then what are some of the other kind of core principles that you lead with?
Well, we were just discussing the quality relationship. So that is a big part of it. And you would think that would be hard to do via telemedicine, which is what I do. But it's surprisingly not that hard. Why? Because you project your personality. You talk to people. You care for them. They feel it. You don't have to be present in person to communicate that to a patient. So that is a huge part of what I do. I establish a caring relationship, a healing relationship. And that's part of every interaction. And that happens because I'm trying to find out who they are and why they have their issues and get to the bottom of it so I can offer them meaningful advice and help them to heal and improve. And that aspect of it is fairly straightforward. And diet is a huge part of it. There's just no question that most of what we are seeing as physicians is a result of metabolic disease caused by overconsumption of sugar, processed carbs, vegetable seed oils, and the constant eating, right? If I had to sum it up, that's it. And if you just can reverse those things, you're on your way to getting healthy again. And then once you do that, many of the medications that you've been prescribed can go away, right? If you can reverse your type 2 diabetes through diet, you don't need insulin or any other drugs. Usually, often, your blood pressure gets better because those two are linked. Metabolic syndrome is the underlying cause of most hypertension and most diabetes. You reverse that metabolic syndrome, and you don't need all those pills. The cholesterol scam is something that I talk a lot about, and people come to me to get my advice on that because I've been outspoken about it. I think the whole cholesterol thing has been a disaster for patients. There is no causative role for cholesterol in heart disease, none. Cholesterol is a vital substance that your body actually manufactures. It's inconceivable that we would have the machinery, enzymatic machinery, to make a substance that is killing us with heart attacks. I mean, it's absolutely nonsensical. And lowering cholesterol is inherently harmful. We need cholesterol. Cholesterol forms a good portion of our nervous system and brain. It's a big part of the immune system. It's the backbone for vitamin D and the sex hormones, and on and on and on. So to try to block the synthesis of this magical stuff is complete insanity. And the harms clearly outweigh the very trivial benefits that are reported by these pharma studies and that are on the order of a 1% absolute risk reduction in coronary events. So there's really no benefit when you think about that, no benefit, and only harm. And the harms are significant. Okay, nervous system issues, dementia, even Lou Gehrig's disease, amyotrophic lateral sclerosis, is strongly related to statins. So these are actually, they're slow motion poisons, and I try to get people off them.
Do you know Walter Cannon? He was like, it was whatever they called doctors like 100 years ago, like physiotherapist or something like that. He wrote this book called The Wisdom of the Body, and my training brand as a trainer, it's fight and flight conditioning, and I came to that because I like to run and do martial arts and stuff like that, but I've gotten into those things because that fight and flight response is like that. That's, to me, what I want to be the best at, is in those fight and flights. That's the core principle. That's the training that's the most interesting to me. And so anyways, that got me into this rabbit hole where I was studying the fight and flight response, and that which brought me to Walter Cannon. He's the one who came up with that, and he also came up with the term homeostasis. And his book, he just kind of talks about the human as a system of fluid tubes, basically. I mean, this is my, even though this was 100 years ago, I'm sure a lot of the ideas are outdated. It was still, it's still difficult for me to get through. But it's that idea has stuck with me, where like we really are just a series of fluid systems. We've got air, liquids passing through. And it's just about like kind of getting to a sense of balance. And I think everything kind of feels good when you're balanced. It's easier to be present. It's easier to have high quality interactions, do high quality activities. That all comes more naturally.
That's the essence of my area of nephrology, which is the balance, homeostasis. The kidney controls homeostasis for virtually everything in the body. A lack of homeostasis is ultimately fatal. This is called the infinite gain theory, which is that, let's say you start to accumulate salt in your body Well, you will have compensatory mechanisms that are triggered to get rid of it. So you will maintain balance. The kidney handles this, behind the scenes, completely invisibly. But let's say you don't. If you continue to have what we call a positive balance of salt, you get heart failure and die. Okay? If you start to lose salt, let's say your kidneys don't hold on to salt appropriately, and the kidney's major job is to retain salt. Okay? And I can go into the math behind that, but it's pretty impressive. Even a 10% reduction of that effort would cause a massive hemorrhage of salt through your kidney and out your bladder. And if you hemorrhage salt, your blood pressure is going to drop. And if you don't correct it, you will collapse and die. Right? So the balance is crucial. And that's why kidney function is so essential. And as soon as you go into kidney failure, let's say your kidney shut down totally, because there are forms of kidney failure where at least you continue to make urine, right? But the kidney shut down totally, then you start to accumulate toxins in your system. And one of the worst, of course, is sodium, because sodium or salt overload kills you from heart failure. So that's one of the first things that we have to pay attention to in a patient that has acute kidney failure, is that balance of salt. And that's a huge part of what I used to do as a nephrologist. But yeah, I mean, we are just different fluid compartments. We have intracellular fluid, we have extracellular fluid. The intracellular fluid is maintained by the amount of potassium in the body. The extracellular fluid is maintained by the amount of sodium in the body. So sodium and potassium are both cousins in a way, chemically, and they are both monovalent cations, and they are maintained inside and outside by the sodium-potassium pump. That sodium-potassium pump, which runs off of ATP, is the stuff of life. I mean, if your sodium-potassium pump goes down, you're dead, right? That's it. You're finished. You cannot maintain the gradient of sodium and potassium across your cell membrane. You're dead.
Interesting. So for you, the kidneys, and more specifically the sodium-potassium pump, that's kind of like, that's at the core of the homeostatic human system. Is that fair to say?
Yeah, I mean, that's right. I mean, the kidney adjusts your output to your intake, right? That's the whole point. Okay. So if you take in a huge salt load, big salty meal, well, you may need some of it, right? You do need salt, and I encourage people to salt their food. I think salt restriction for most people is a big mistake. But if you exceed your body's needs, you trigger compensatory reactions, okay? There are stretch receptors in the large blood vessels that let the kidney know we're a little bit distended here. The vascular space is a little bit full. So then you start to trigger responses in the kidney to get rid of that extra sodium. And it does this seamlessly, completely in the background. And the same would be true, say, for potassium. If you take in too much potassium, the kidney has a way to increase that excretion. And for most elements in the body, there is an inherent balance. That is, a lot of it is regulated through the kidney. Magnesium, calcium to a large extent.
Interesting. Yeah, I honestly haven't thought about the kidney as being that central to. I mean, it was just one of the human parts. I have to learn more about physiology, but I wanted to circle back to the vaccines point. We touched on it earlier. I'm curious, what are your thoughts on vaccines in general? Would you advise like anyone take them, take some of them, take all of them? It sounds like not that based on our previous, but yeah, like, are vaccines bad, period? Are they bad sometimes? And if so, in what context are they good and bad?
Well, my thinking has evolved. Like many of my colleagues, we came through the COVID experience and saw how bad that vaccine was and how they tried to force it down our throats and into our arms. And we all started to re-examine vaccines in general. Now, there have been people way out ahead of this. I'll mention two. Suzanne Humphreys, who, by the way, is also a nephrologist. She wrote a book called Dissolving Illusions over 10 years ago, maybe 15 years ago, pointing out that all of the supposed benefits of vaccines in terms of reducing mortality for various infectious diseases was bogus, that the mortality rates had gone way down before the introduction of any of these vaccines. And blocking the name. It'll come to me, but another, key person who also from the very beginning was skeptical about vaccines and was campaigning against them, so to speak. So I have gone from being fairly accepting of vaccines, although I never really was into pushing them. I just assumed that the propaganda that we all heard about vaccines was accurate, but it isn't. And what, I credit Del Bigtree and Aaron Seary from, ICANN, the Informed Consent Action Network, getting a lot of this information out. The fact that there are really no quality, true placebo-controlled trials of vaccines. And these are given to children, babies. They are based on the premise that we are born with a defective immune system. Well, where's the evidence for that? That's not true. The immune system is designed by God to be perfect, okay? It can handle anything. Plus we have maternal antibodies coming through the placenta. Plus we have antibodies coming through breast milk. There is absolutely no need for a baby to get a vaccine. None whatsoever. And they are harmful. In fact, when the 1986 law was presented to Ronald Reagan for signature, the bill was presented to him to grant indemnity to vaccine manufacturers for legal liability. His question was, well, why can't you just make safer vaccines? And their answer was, vaccines are unavoidably unsafe. Well, there you have it. There you have it. And they are, because these are foreign substances. They're foreign proteins. They are aluminum-containing adjuvants. There's mercury in a lot of these, in thimerosal. So these are neurotoxins. And the fact that a kid would go home and have a seizure after getting a vaccine should tell you all you need to know. So there are kids being killed by vaccines, even as we speak. This whole issue of sudden infant death syndrome is vaccine injury. Right? This didn't exist until we had this huge childhood schedule of vaccines. And we lead the world in sudden infant death syndrome because we have the biggest and most egregious vaccine schedule for children. So I don't think any vaccines at this point are justified. I had some as a kid. I had natural infections for everything, whooping cough, measles, German measles. I had everything as a kid. Somehow lived through them. I used to get a flu vaccine because there was a huge campaign at the hospital where you almost had to, right? That you could not see patients unless you had a flu vaccine. This was based on nothing. These flu vaccines never worked. And I also got the first generation of hepatitis B vaccine because in nephrology, we're dealing with blood, and there was a high incidence of hepatitis B in doctors who worked and nurses who work in dialysis units. So that we kind of gladly took. But who knows, number one, they did produce antibodies, okay? Antibodies don't necessarily protect you from disease. That's only one component of the immune system. Much of the work of the immune system is done by T cells. And T cells are not affected by vaccine. Vaccines are intended to induce antibody production. So at this point, I am thoroughly anti-vax, okay? So if people want to hear this and want to call me that. I'm proud. I'm proud to be an anti-vaxxer. Okay, throw all the insults at me you like. I don't care. I don't care.
I don't pay as much attention to politics as I could, but I know Robert Kennedy is that was one of his big cornerstones when he was running for president, and then teamed up with Trump. But is he? I haven't been paying enough attention. Is he doing anything about the vaccines? And kind of since this new administration, have you seen
He
the
has.
climate shift around vaccines? Okay, so
Yeah, I mean, he has. I mean, and this was our hope that he would be able to change what's going on there. First of all, he fired the entire advisory committee, the ACIP, and put in people that he felt he could trust. And some of them are very good people, like this guy, Retsef Levy, who's been fabulous. And they are then evaluating vaccines with a more critical eye, shall we say, and insisting on actual safety studies, which haven't been done. Right? You have to use a true placebo, which means a shot of salt water. But instead, the vaccine manufacturers, when they do placebo studies, they use an active placebo. So it's got an adjuvant or something in it that makes it cause a reaction. So he has done that. They've cut down the childhood schedule. They're making it look more like the schedule in Denmark. So a bunch of vaccines are now off the childhood schedule. That is already a huge plus. Okay, we the schedule is kind of like a very important idea, because everything on the childhood schedule gets the immunity protection from liability. Once you're off the childhood schedule, not really. Okay, then you're exposed. And also, the childhood schedule gets mandated at the state level to go to school. Not all states, but most mandate the childhood schedule. So you have millions and millions of young kids literally being forced to get these shots. And pharma's making money off this. This is a huge source of revenue for pharma. I call it the vaccine gravy train, because they've done virtually nothing for that. It's mandated. They don't have to even convince people to take it. They're forcing them to take it. They get fully paid for it. It's a scam. And sadly, the pediatricians are a big part of the scam, because they get paid big bonuses for vaccinating kids. So they're strongly motivated financially to administer these products. And I believe that is unethical, right? You should not have a financial motivation for a particular product that you're prescribing. But they do, and a lot of money. And one of my friends in this, who I've met during this period, Paul Thomas, a great pediatrician, he had a big practice. He became aware just by clinical observation that his vaccinated kids were much less healthy than his unvaccinated kids. And the reason that he had two different populations was because his practice didn't require vaccination. They actually gave informed consent and allowed families to opt out of being vaccinated. Well, so he acquired a large number of kids who were not given any vaccines. And he then looked at their health records, because he had them all in his files, right? And he published a paper reporting much lower incidence of various childhood diseases, bronchitis, asthma, infections, ear infections in the unvaccinated group of kids. Well, a few days after this report was published, the Oregon Medical Board came after him and stripped him of his license.
Jeez.
Really, Stalinist kind of tactics here. But he has documented the enormous financial incentives that pediatricians have to be a vaccinator, right? It's you get a bonus per vaccination, and then if a certain percentage of your kids are vaccinated, you get a big bonus. So it's like $1 million a year or more for a big practice. And he documented that with his numbers.
what is your feel for kind of like the pulse of the vaccines or anti-vaxxers and the cultural perception? Like, um, do you think that the tide is kind of changing on how people perceive vaccines and people who don't like vaccines? Like you were mentioning earlier, you're an anti-vaxxer, you're proud of it. Do you feel like the response is differently now than it was 5 years ago or something like that?
Yeah, well, I don't know. I'm not out there taking the
Yeah.
pulse of the nation. But what I can tell you is that until Elon Musk bought Twitter, you couldn't even tweet about this. There was so much censorship at every level about vaccine criticism. You couldn't if you were in an academic career, you would be thrown out of your job if you came out publicly criticizing vaccines. So I think a lot of that has changed. And as the word gets out, people are starting to think for themselves. And yes, people are starting to say no. Well, I can tell you that vaccine uptake is down. Number of kids getting childhood vaccines has gone down. Number of flu vaccines administered has gone down. So this is all good news because patients are going to be healthier for not taking these shots. And pharma is going to be poorer to the extent that they could ever be poor. I mean, they have so much money, it's insane. But to a certain extent, refusing vaccinations defunds pharma. They live off the vaccine schedule, right? They have a few blockbuster drugs, like the statins are another big blockbuster that I would love to see go away. The psychiatric medications are big blockbusters that I think are awful and they should go away. So we have in our power the ability to defund pharma. They are way too powerful. And their advertising on TV, that was a huge step, right? The fact that they were allowed to advertise on media, on television, enabled them to bribe the media and control them. So that's why you never saw negative reporting on vaccines, when before that you did. Right? There were examples of reports on television, on national television, critical of various vaccines, but they completely went away. And it became verboten for a news anchor, let's say, to allude to a vaccine harming somebody. And we still see it, obviously. All these younger people who have died, these what we call died suddenly cases, most of them, if not all, are vaccine related. The vaccine causes myocarditis, it causes destruction of blood vessels, aneurysms of blood vessels, so bleeds in the brain, bleeds elsewhere, blood clots, kidney failure, they cause kidney failure. So when you hear a news report about someone well known who dies in their 50s, well, that's an unexpected death. We should know what their vaccination status is, shouldn't we? Well, is it ever reported?
No.
No, they never report it. And when I see this, I think this is negative evidence. One of my colleagues at the Association of American Physicians and Surgeons, Dr. Jane Orient, really a brilliant lady, has written a lot about this. Negative evidence is when you should see something but don't. And that is in of itself a clue. It's like with Sherlock Holmes and the dog that didn't bark. The fact that there is no reporting on vaccine status of someone young who dies suddenly, unexpectedly, leads me to conclude that they were vaccinated. Because if they weren't, then they would probably report it. And so that's still going on. And doctors are complicit in this, sadly. They don't report these to the vaccine adverse event reporting system. And they should. They should be reporting all these. They should be getting autopsies. And autopsies have almost vanished. They used to be a big part of medicine. We learned a lot from autopsies. And now they're very rarely done. And they certainly should be done in anybody who dies suddenly and unexpectedly. should get an autopsy, and there are special stains you can do of the heart and blood vessels, etc., to show the damage from the shots. And there's a German pathologist, Arnie Burkhardt, who did the best study of this ever. Sadly died somewhat mysteriously after he published this stuff, but that work is still out there, and we actually have colleagues who are trying to put it together into a paper and get it out there. And when you see the actual tissue level damage, that's what pathology does. They look at actual cuts of tissue and special stains. When you see the actual tissue level damage, it is heartrending, literally, to see how destructive these shots have been.
All right, let's say, for the sake of argument, that vaccines are causing some of these effects and also other negative effects, and that pharma knows about it and is actively trying to hide it or suppress it. Would there be any reason for them to do so other than money? This is getting back to when anti-vaxxers were real anti-mainstream, but the reputation of them was like, oh, they think that they're trying to microchip us, or they think that they're trying to keep us dumb so they can control us.
Well, that's true.
Yeah, okay, that's what I'm getting at. Do you think that there's any possible like intention other than just keep, like, they can control us with the money? They keep us owing them money. Where like you were saying in the beginning, we're effectively their employees. But yeah, what else could be gained from controlling vaccines as big pharma?
Well, from pushing vaccines. Well, the nefarious view is that it's about population control, right? That they're actually trying to reduce our numbers on the planet. And they have said this in no uncertain terms. People like Bill Gates are Malthusian. They think the world is overpopulated. This is an undercurrent that has been around for a couple of centuries, I believe, that doesn't seem to be going away, even though it's an absurdity. And anybody who's ever gone across the country or gone across Canada and seen all the empty space in this planet, you'd be insane to think that there are too many people. No, we need many more people, right? People are the greatest resource because people come with intelligence and creativity. Without people, we become a dying breed. And it's concerning that we are declining in population. So this is the very dark side of vaccination policy. I think that at the level of pharma and the executives, mostly they're into the money. I think greed explains 90% of it. But there is behind the scenes, there is a depopulation agenda afoot. It's been out there for a long time, and they don't even really hide it. Too many people. We should have maybe 1 billion, maybe 500 million people on the planet. That's a lot of dead bodies going to pile up if they have their way. But Mike Eden, who's a colleague in Britain, former pharma exec, he actually worked with Pfizer. He has said that the vaccines, the COVID vaccines anyway, were intentionally made to be harmful. That there's no way they could not have known that these products would be harmful. Because number one, they use as their antigen this protein called the spike protein, which is itself pathogenic. It itself causes disease. It activates platelets. It clings to blood vessel walls. Well, there you have blood clotting right there. So they must have known this, yet all 4 manufacturers of the mRNA and DNA vaccines chose this protein as the one that they were going to use as their antigen to stimulate an antibody response. So and they had huge numbers of adverse events, even during the trials, the pivotal trials, and proceeded anyway. And that's one of the truths about all vaccines, is that they are all more harmful than beneficial. Paul Thomas, again, I'll credit with putting the numbers together. The mortality risk from all the vaccines on the childhood schedule exceed the mortality risk from the diseases they supposedly prevent. The reason that they never do true placebo-controlled trials, which would show safety, right, is that they can't show safety because, as they say, they're unavoidably unsafe. Could they show a benefit? Well, no. It's impossible to show a benefit from a vaccine for a disease that is so rare that you're simply not going to get it. In other words, you couldn't get an effect size big enough to be significant. So even with the COVID vaccines, they didn't show any improvement in mortality rate. They didn't show improvement in hospitalization rate. What they showed was a tiny decrease, percentage-wise, in serious, so-called serious symptoms from COVID, because there just weren't that many infections, okay? So in order to show an effect of something, you have to have real benefit, and you cannot show that with any vaccine. You can't even really show it with things like statins. As I said, you have a 1% risk reduction for a composite of endpoints because people don't get heart attacks that often. So it's hard to measure an effect. So vaccines are accepted on faith. They're accepted as a religious article of faith without evidence that they actually work, but with evidence suppressed of harm.
Interesting. Give me a lot to think about. I've got one more question for you, and I was actually thinking about this earlier in the conversation, and the conversation moved on, but I wanted to circle back for it. Kind of end on a positive note, maybe. I'm curious, in your experience, all right, let me take a step back. So, as a trainer, I would say my specialty is the nerves. Like, most people focus on the muscles. I kind of honed in on the nerves, and what makes the nerves different is muscles are you can stimulate it by much more structured programming. Just weight and reps. It's like a math problem. Your muscles will weight, reps, and then calories in, calories out. You can calculate how much muscle mass are you going to grow. The nerve development is different because it's like a quality metric. Nerves is like training your nerves is like training baseball swing or a punch in martial arts or something like that. It has a lot more to do with like greasing the groove and getting quality reps rather than volume of reps. I would say that the quality becomes exponentially more important in this type of thing. So I'm curious, are there in the medical field, is there like that love, that care that you're talking about, bringing that as a practitioner, is that alone enough to enhance the quality of the interaction to the point where the patient can receive benefit? Does it make sense what I'm asking?
Well, I think it's still a hugely important part,
Yeah.
or should be a hugely important part of medical care. The patient-physician relationship is what generates healing. And that has been lost. And sadly, is now the doctor-computer relationship in most offices. So I think that can help in any setting. Caring is, Persig's definition of this is that you see caring and you see this person is a high quality individual. I mean, his great example of watching a good craftsman work on a piece of work, build something. He's not really following any particular guideline, right? He's just interacting with the material and providing his input and getting feedback. And then at a certain point, he's at peace with it. and he says, okay, I'm done. It's finished, right? It's a work of art. It's a work of whatever he's doing. He applies the motorcycle maintenance analogy, which I loved. I used to ride motorcycles in those days. And, talking about how you go to a good mechanic's shop, everything is ordered, everything is clean, right? He's not distracted, he's focused. So you can apply this to every aspect of life. That was the lesson from that book, which is that we need to take the time to focus on what we're doing, be at one with it, right? The Zen, be part of it, and experience the quality which is undefinable.
I like it. How about this? This is what I'm thinking. We've got care leads to homeostasis, which generates healing. That's kind of my synopsis of the last hour in the simplest way.
Well, care, and the
quality
judicious
care,
the judicious use of diuretics in certain patients.
Yeah. Awesome. Well, this was a lot of fun, Richard. I will include your Substack below. If anyone's interested to dive into your stuff, is there anywhere you'll direct them other than your Substack?
Well, goldcare.com.
Goldcare.com.
I encourage people to sign up. It's a very low monthly rate. You have access to all of our educational material, including lectures that I do and others do. I have some really great talks on there that I've gotten from other people. In fact, I'm directing the academic program there. And you can get a consultation with any of our very caring, qualified practitioners.
All right. Well, I will include that link below. So anyone watching, you can find that in the description everywhere this is posted. Thanks again, Richard. I really appreciate you coming on.
Hey, take care, my friend. Be good. Cheers.